Welcome to the Gyne Awareness Podcast, real talk to understanding gynecologic conditions and care. The goal of this podcast is to bring you clear, evidence-based medical information by experts in the field of gynecology to help empower you in your health journey. Participants on this podcast are healthcare professionals, specialists and advocates in the field of minimally invasive gynecologic surgery. The views and opinions shared in this podcast are those of the speakers and do not necessarily reflect the official policy of AAGL. This content is provided for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Listeners should always seek the guidance of a qualified healthcare provider with any questions about their own health. If you are experiencing a medical emergency, call 911 or your local emergency number immediately.
Let's take a step back. Let's walk me through, a patient comes in, they have some number of fibroids. They're, let's say, in their 30s, right? It's not really particularly bothersome. You found them on exam. What sort of medical options might you offer a patient? Maybe they've got slightly heavier periods. Maybe you just found these incidentally. How do you counsel patients on what their options are for treatment?
I guess it depends on what the bother score is, right? How bothered are you by your symptoms and how much you normalize them? So if the primary concern is abnormal bleeding, the first thing we can discuss is how to minimize that, how to decrease the volume of bleeding or the frequency of bleeding that you're having. So if we're going to focus on medical treatment, most of it is unfortunately going to involve hormonal manipulation to decrease the volume of bleeding. And there are a multitude of choices here as far as hormones go, from the simple birth control pill to progestin-only preparations where you don't use any estrogen, which a lot of people are concerned about, side effects, so forth and so on. But also there are medications that are designed to improve your ability to clot or not bleed as much during your cycles. So anywhere from hormonal treatments that are simple, mild, to heavy hormonal treatment where you would completely suppress the ovaries or the production of hormones that will lead to ovarian stimulation, and also medications that can decrease the volume of bleeding by different mechanisms.
Yeah, what do you tell folks? Oh, go ahead. No, please.
Go ahead. No, go ahead.
I was going to ask, the patient who says, what do you mean, you're giving me estrogen or progesterone? I looked up on the internet and it says that these tumors respond to those hormones. So isn't that going to feed them? How do you respond to that question?
Oh, me.
Please.
You're up, Jamal.
So I'm a progestin user, I really emphasize the fact that both are okay to use, whether it's a low dose hormonal preparation that contains both estrogen and progestins, or just focus on the progestin component, depending on the patient's preferences or the side effect profile they've had in the past with prior preparations. So I like to use progestin only to suppress the ovaries. So that means that you will not ovulate for the month and therefore not produce as much estrogen and progesterone naturally, which will slow down the bleeding process, if not eliminate it, depending on where the location of the fibroid is. And hopefully it will decrease the growth of the fibroids, because the fibroids will have receptors within the body of the fibroid that where estrogen and progesterone can play a very important role in the rate of growth. So some argue that using preparations like that may halt the growth of fibroids, although I don't know if anybody's been totally successful with that. I know I have not. We can certainly reduce the amount of bleeding and make hopefully the cycles more comfortable and more tolerable.
Arleen, I cut you off. You were going to say something.
Yeah.
I agree with what Jamal is saying, and I kind of lost my train of thought with what I was saying before. So it'll come back to me. Don't worry.
Apologies. Blame me. Sorry.
No, I don't know. It's totally fine. Totally good. All good. It's all gonna come back. I'll be talking in a minute. So yes.
Well, I think it's interesting, right? Because young women will often get diagnosed with fibroids and they'll say, like, okay, I don't want to do anything. I don't want an intervention. I just want medical management. So often I even tell them, like, well, if it's not really bothering you, like, we could just observe these, right? Like, we could get another ultrasound or an MRI in 6 months or a year and make sure they're not growing too rapidly. Oftentimes when they come to our office, right, they have been through that path. And that's why we don't even start with the observation, right? Because they've already been doing that for so long. But I think, medical options are really reasonable for people who are just having some additional bleeding, and we can often get it under control. But we know, because we are all gynecologic surgeons, that that does not work for everybody, right? So,
Right.
so what sort of procedures do you guys like to offer patients, both patients who are thinking about, pregnancy in the future and those who may not be thinking about pregnancy any further? What sort of procedures do we have out there?
I mean, well, we have, I mean, there's, I would say there's many, but not enough, maybe is what I would say. And, I think again, it's as we have to, we determine what is appropriate for the patient. And part of that depends on the type of fibroids they have, the symptoms that they're having, the severity of the symptoms that they're having, their fertility goals, their uterine sparing goals, those kind of things, um, their overall health. There are a lot of things that go into determining what the best surgical intervention is, but obviously the least invasive way to manage fibroids and also take care of their symptoms is most people's goal, right? So if they have a submucosal fibroid that we can take care of vaginally, and that's going to keep them from bleeding every month and being anemic, which for some patients, really that's all they need, then that's what we're going to do. Some patients are going to need myomectomy. Some patients may need radiofrequency ablation or be candidates for that. Some patients may need a big open incision for myomectomy for their, they may be a minimally invasive candidate for myomectomy. Some patients need hysterectomy. So there's many different treatments surgically, and part of that depends on a lot of what's going on with the patient, what their symptoms are. But obviously the least invasive thing you can do for the patient is going to ultimately be the best and take care of their symptoms. And that's a lot of times what I'll tell patients. I'm like, I can take out this fibroid, but it's not going to help your bleeding, because sometimes patients think that they have this big, huge subserosal fibroid that's causing their bleeding, but their bleeding is actually being caused by another issue, which is maybe something hormonal. They have some, anovulate, something going on hormonally that's causing their bleeding. That's not related to the fibroid, but they want to take out the fibroid. And so part of that is patient education and my doing my job and making sure that I know what's going on with the patient and helping them to choose a procedure that's going to take care of the symptoms that they are having in the safest way possible.
Yeah. Can we just go back to a few of those things that you said? Let's explain to our patients listening, what is radiofrequency ablation? What does that option even look like for them?
No, I may be dating myself here, but when I was in training, there were so few options for the treatment of fibroids. And today we have this plethora of, different treatment choices, one of them being radiofrequency ablation. And I think that really has added a lot of oomph to our discussions and an additional safe, reproducible, and valid option for patients that have fibroids and don't want to do major surgery. So radiofrequency ablation, the way I think I would explain it best, is utilizing technology that can deliver heat to the inside of the fibroid, and not to remove the fibroid, not to scrape any of the fibroid out, but simply to try to melt down the core of the fibroid to change the size and the consistency of the fibroid. So although it does not remove it, it will soften it up, reduce the volume, and help reduce the bulk symptoms related to larger fibroids. I like to use the analogy that a fibroid can go from, feeling like a baseball to a marshmallow, and that helps reduce the symptomatology associated with it. I'd be interested to know if it reduces the inflammatory component of it. So I'm dying to do this research project with someone. If anybody wants to sign up with me, we can do a multi-center or multi-institutional project, but I think that would be the key. For example, I know there's no clear indication yet or enough evidence to say that these procedures are safe for women that are seeking fertility. So I don't use it as a primary treatment option for patients that are in the process of trying to become pregnant or planning to become pregnant. I use a disclaimer that there are a lot of reports out there and some literature emerging stating that pregnancies have been okay after utilization of this procedure. But nonetheless, it's not FDA approved for that purpose, but it is approved to reduce the symptomatology. And a very good, I know I'm talking too much here, but I think an important distinction to make between a radiofrequency ablation and an embolization procedure. An embolization procedure is when we block the blood flow to the fibroids to make it lose its blood supply and become ischemic, necrotic, and eventually shrink quite a bit. The difference here is that there's no ischemic changes when you use the radiofrequency ablation. So there's no cutting the blood supply to the fibroid. Therefore, supposedly the pain component associated after treatment is much reduced with the radiofrequency ablation. I think I got off topic here, but
What's
no,
cool,
that's what my
though,
next
is that
question was about embolization. So it's a
There you go.
perfect segue, Jamal.
Yeah.
if you don't mind, just the following up on that, what's cool is that the technology continues to evolve and we have more tools available to us. So, with this radio frequency ablation, you're taking a tool that gynecologists are really comfortable with, ultrasound, and that helps determine the location of the fibroids and be able to guide the treatment. That little probe that you put into that fibroid that's going to end up elevating the heat, like you were saying, Jamal, and causing that fibroid. Basically, you're cooking it with a little probe, and that ultrasound helps guide it to the right place so that you can do that safely.
Under sedation.
Yes, so you get good point that you're not awake during this, or feeling all these things, at least not fully, depending on the approach. And what's cool now, is that you can approach that through a tiny abdominal incision, so laparoscopy, or even now going with a vaginal procedure going through the cervix, and so there are no incisions on the abdomen at all, and that can be a really nice way to take care of somebody's symptoms and maybe buy them some time from, before they need to have a more invasive procedure, and maybe even avoid it altogether. So it's just really cool the way that the technology is giving us different options to tailor that treatment for the individual person.
Yeah, I totally agree with you, both of you, in terms of talking about radiofrequency ablation and even embolization as being great options for patients who are trying to avoid sort of bigger, more invasive surgeries. Now, embolization, though, is done by our radiology colleagues. And as Jamal mentioned, it blocks the blood flow. So it is quite a bit more painful, in my opinion, for my patients. I do use it, though, pretty frequently because it's been FDA approved for so many years, since 1998. And there's been lots of, data about pregnancy afterwards, even though it's still not FDA approved. My question for you guys, though, is what do you tell patients who just say, doc, I want the least invasive thing done, but those things are not FDA approved for pregnancy, and I'm just not ready to take on something that, I still want to go on and get pregnant. I'm only in my 30s. What do you talk to patients about that? What are our other options? Arleen, what do you think?
Well, I mean, again, I think it has to do with what their symptoms are and things like that. And if they're not ready for intervention or they want to wait on intervention, I think we have to think about how do we kind of delay the growth of these fibroids? What can we do strategy-wise? I think we have medications that really will help us with that a lot more than we did at least when I was training. We only had Lupron as an injection, but now we have Orion and Myfembree that we can use for longer, and probably, even though not studied, we probably can use it for longer than 2 years. But I think we have to kind of think about when we see these patients, and even when we see them in their 20s and they're asymptomatic, really how are we going to manage these fibroids in the long run for, to kind of delay maybe intervention or time their intervention to when they need it. But, I think you really if I'm going to avoid surgery, we're going to avoid surgery. I don't want somebody, living their life chronically anemic. And I think because that has implications for their overall health. You know, they're young and they're living at a low blood count, but if they're chronically anemic, it's not good for them. And I think having that conversation with them will usually move them towards doing something. But, I think exploring all your options is probably the first thing you want to do, and then going from there, and just finding the right fit. Yeah, that's kind of how I approach it.
Thank you for listening today. We hope you enjoyed this podcast. To listen to other podcast sessions, visit us at gynawareness.com. You can also follow or subscribe to the Gynawareness podcast on Spotify or Apple Music.